If you've ever had pain on the inside of your elbow and not sure what it is, we're going to talk about that today. It's called medial epicondylitis or golfer's elbow. Hi, I'm Dr. Jim Hoven of Ramos Law and your host of Health Matters. This is something that is often overlooked and something that can be treated very easily. Stay tuned. We're going to talk about it right now. A lot of people have heard about tennis elbow, but one of the more lesser common elbow injuries is known as golfer's elbow. The technical term is medial epicondylitis, medial being on the inside of the arm, epicondylitis being the epicondyle of one of the bones coming up on the inside of your arm. A condyle is at the top of that, and the term itis, so epicondyle, it means that it's the part of the epicondyle of the bone, and itis meaning inflammation. So it's inflammation of the medial side of the elbow. Now, epicondylitis is caused by rotating the arm consistently. That's why it's called golfer's elbow, because of the swing of the golf swing and the grip and the internal rotation of the shoulder. All these things combine to create tension right along this area, and it can be very painful. Now, there's a lot of treatments that you can use for medial epicondylitis, and one of the easiest ones is soft tissue work above and below the area of injury. So when this tendon comes up, the muscle comes up on the inside, and as the tendon crosses over the elbow here, if we can do a little bit of what's called transverse friction on the elbow here, and then we can do some distraction of muscles, some rubbing of muscles, using different muscle tools, all of that takes pressure off of where the muscle is attaching to the bone, because it's the pulling on the attachment that's causing a lot of the pain and the swelling. Another thing that we can do for medial epicondylitis is to take a pressure strap and place it below the area of pain, so more on the forearm, the upper forearm, and that's going to trick the forearm muscles to think that they're attaching to where the strap is. So we strap that down tight, and that takes pressure off. We typically only use that when we're going to be actively using the elbow in order to allow us to function okay, but that's not really the good treatment. So the treatment is going to be doing some of the muscle work. We can put electrical stim here. We can do soft tissue work with needles, like dry needling technique. All of these things that allow the elbow to move better without restriction, because the normal muscle length and the normal muscle function is maintained, as well as normal joint mechanics of the elbow, wrist, and even shoulder. So all of these things come into play to take care of medial epicondylitis. One final tip for medial epicondylitis: a great tape job. So if you know what kinesiology taping is, we can put tape right along the inside of the elbow and then a couple strips across. That will do wonders to help maintain any treatment done and take pain away from medial epicondylitis. So hopefully that gives you a little more idea about what golfer's elbow is and how to treat it. If you have any more questions about this type or any other type of injury that I can help you with, please feel free to reach out to me by email, jim@ramoslaw.com. If you found this video helpful, please pass it around. I know that people have this condition, and I would love to help them in any way that I can. So until next time, just know your health matters.